Mike, you want to hear from me or the dog? I want all the children that are having a good time to raise their hand. Raise their hand. There they are. Everyone's hand. We thank them. So we want to thank you. We want to thank you all for coming here and visiting us here in Washington. This is a special treat for all of us because you are here. So we thank your parents for bringing you here. And we thank all those that care about children in the medical world for being here as well. My colleagues, John and Mike and Jim and the rest of our Massachusetts and New England delegation. So I wanted to bring my two dogs. They heard I was going over here and they thought I was going to see you this morning, and they knew I was going to see you. They said to me, we want to come, and so Slash and Sonny came over, and so far they behaved themselves pretty well, but they're looking around for a muffin, and they're not supposed to have, either is their owner, they're not supposed to have it, so don't let us do it. On a serious note, thank you for coming. The Children's Hospital and our related friends throughout New England are just indispensable to all families. And you don't have to be a working family, a middle income or a low income family. You can be a United States senator and see that the Children's Hospital probably saved the life of my son Patrick. I remember Patrick, who was a chronic asthmatic. He was up at school and he had this enormous challenge in terms of breathing, went up to the Lawrence Hospital and was unable to get treated, and then came down to the Children's Hospital and he had intensive care there for 5 days. They had certain kinds of approvals to be able to use certain kind of drugs. They were able to give it to him when he was a teenager, and no question probably saved his life. And we've seen with regard to the Children's Hospital in conjunction with the Dana-Farber Center, when my son Teddy had osteosarcoma in his leg, had a new experimental kind of prescription to be able to technique in dealing with the osteosarcoma after Teddy lost his leg, and it was successful up to that time. He had about a 15% chance of survival. So this Children's Hospital and its affiliates are just indispensable life givers to all of us in Massachusetts and New England. And we want to, in the Congress, make sure we do everything we can to make sure that they are continuing to do their mission for the children that are here today and future children. It starts off with making sure that we are going to be able to get the trained personnel. I was in the Senate when we passed the Medicare. In the Medicare legislation, we were saying, how are we going to be able to train professional people to be able to deal with our elderly? And we used the Medicare to provide trained personnel for our hospitals all over the country, but we didn't include pediatrics. That was excluded because there couldn't be the justification. For every other kind of profession, you could say, well, our seniors are going to be faced with other kinds of challenges, and therefore we can use the Medicare system to do it, but not for the pediatrics. So they were excluded, but we've gotten them now included. And I commend the House Appropriations and so many of our colleagues here to make sure you're getting full funding on that, because we have an administration that cuts back on that every single year. Why, I don't understand. Serving in the Congress is a question of priorities. And I can't think of more or higher priorities in making sure we're going to have the gifted, talented, highly motivated people that work with our children. But we have people in our delegation, we've been joined by Bill Delahunt, that are strongly committed to making sure we are going to do it, and we're going to fight for you in the Senate. Secondly, we're going to have the reauthorization of the CHIP program, which was a program which I introduced in the Senate with Orrin Hatch, which is really modeled after the Massachusetts program, and has been accepted. It's been reduced and cut back. It's been threatened, but we have been fighting those reductions. We're still only getting about 60% of all the children that ought to be eligible, and into that program we have the reauthorization, and we need that program. And finally, we want to be able to continue the kind of support on the kinds of research that Children is doing, the cutting edge research. We are in the life science century, my friends, and the possibilities that are out there in terms of trying to unravel, and find ways of dealing with all of the challenges that children are faced with are virtually unlimited. Virtually unlimited. There's never been a time that we have as great a potential as we have at the present time. And we've got to make sure we fund that. There's nothing more important. We're spending $10 billion a month in fighting in Iraq. We can afford to invest that much and much more, what we're spending in 1 month over in Iraq in terms of children and children's research and unlocking these various kinds of challenges. So we are strongly committed to that. I just thank you for being here. This is always a wonderful, joyous reminder about how important each and every one of your priorities are, and it is also a very, very important reminder about why we're here in the United States Senate. Thanks very much. Nice to see you. Thanks a lot.